Hi guys, I'm Eric, co-founder of Delos Therapy, and I'm with Gina, co-founder and CEO of A Sweat Life. We're going to be talking about tight IT bands today and how you really don't have a tight IT band, you have a tight muscle underneath the IT band. All right, so let's get started loosening up the IT band, or actually the muscle underneath the IT band. So the critical part to understand is that we're applying pressure along the entire length of the muscle. So first thing I want you to do is go on your side. And you want to find the tendinous portion of vastus lateralis. You can kind of feel it. It'll feel like a tendon right at the lateral knee. You want to put the knobble right at the bottom of that. And it should be pressure that feels good. It feels therapeutic. So it shouldn't be too much. It shouldn't be too little. It should hurt so good. That's something that we commonly hear. So the critical part is use your body weight to apply that pressure. Find a comfortable position that's stable, and you want to move the knobble in about half-inch, inch increments at 3-second intervals. So apply pressure for 2 to 3 seconds, move it about an inch up that muscle.
So Eric, I'm moving up this muscle, and now I'm right about at the top.
Yep,
right?
so now with the same cadence, let's move down the exact same line. So the IT band and the vastus lateralis is actually pretty wide, so we want to break this up generally into 3 different parts. So you want to go right down the center of it, come back down, and then go a little bit more in front, go up, back down, and then a little bit more on the back side. So again, 2 to 3 second intervals per press, moving in about 1-inch increments. You don't want to move spacing too much between each one, because then you're missing some of that muscle. So keep in mind, when you're loosening this up, what you're doing is you're actually loosening up vastus lateralis underneath the IT band. So something I hear every single day is people come in and they say, I have tight IT bands. Great, you want a tight IT band. It's connecting your ilium to your tibia. You want that to be taut, but what they really mean is the vastus lateralis underneath it is tight, and that can cause a lot of pain. That can cause hip pain, that can cause knee pain, it can cause pain in the muscle belly. So we just finished up the first line, so going right down the middle of vastus lateralis, in about a 1/4 inch, half-inch increment anteriorly, so more forward, do the exact same thing. So you want to go up the line and down the line. It's not a dramatic change as working through here or working back in the hamstring. It's really focusing on the outside of this muscle.
Okay, got it. Moving up. Anterior, the front, found it. And remember, you at home, as I'm moving up this muscle, can be doing this with a lacrosse ball too, right?
Yeah, so anything that is a pretty hard surface that can apply focused pressure to an area to force it to stretch. That's important. If it's too broad, it's going to be more of a compression and you won't really feel much. You'll have to use so much pressure and actually won't break apart any tightness, but it shouldn't be so sharp that it concentrates the pressure in one small area so that now it becomes painful. So it should mimic sort of the surface area of the knobble, your elbow, lacrosse ball, something like that. But the key is 2 to 3 seconds per press, just moving straight up the muscle and back down that same line. So when you go up the area, you'll notice that it'll feel tight and it'll feel tender. When you go back down the line, there should be a decrease in sensitivity and you should be able to go deeper into the muscle. We call that the 2-pass method. So it's very important to do each line twice. So this should take probably 5 minutes. You want to go up the central line, down the central line, move slightly anterior, go up that line, down that line, and we get to the end, and now we're going to go slightly more posterior to the very first central line that we did.
All right, posterior, the back.
How does that feel?
Found it. Oh yeah, that's different. Each time is a little different.
Yeah, so that's an important point. So always think that tightness is 3-dimensional. You cannot come in at one angle. Your tightness isn't located in one plane in one particular spot. You have to come in at multiple angles if you want to loosen that up. So the whole point of this is we're really hitting a similar line of tissue, but we're coming in at different angles.
I know that I am a runner who always thinks my IT bands are tight, and I'll stop and I'll do that figure 4 stretch while I'm running, and I'll feel better for maybe half a mile or maybe a 1/4 of a mile, but then it tightens right back up again. What am I experiencing when that happens?
Yeah, the reason it tightens right back up is because you haven't changed structure, right? So if you really think about the tightness of the muscle underneath the IT band, the vastus lateralis, it's full of collagen. It's full of dense collagen that's rock hard. that has to be broken up. And it's deeply embedded underneath the muscle. So if you think about, here's the surface, and that tightness is very deep, rolling across the surface is never even accessing the problem. You have to go in and physically separate to change structure, because when you change structure, that's a permanent change. It doesn't mean you never need to do anything for the rest of your life, but that is long-term change in that tissue. By rolling over the surface, you're never changing any kind of structure. So it might loosen up some superficial fibers, barely, but that's not going to be a long-term change. So now let's move to the other side. Always do things both sides. Yep, so start at the very bottom of the muscle, so you can kind of roll back and forth. You'll feel the tendon. You want to move up a little bit so you get to the more muscular part. That's your starting point. So you want to go right down the center of that. So when you find the right amount of pressure, that it should hurt so good that it feels therapeutic, then keep the cadence of about 2 to 3 seconds per press, moving about an inch along each time. So not too big of a gap. You don't want to miss any of that tissue. And really, to guide the process, think about what the intention of this therapy is doing, is you're forcing a stretch at the location of the pressure. Very, very, very different than stretching your hamstring, stretching your quad. Any type of stretching like this, or stretching out your IT bands, what you're doing is you're stretching lengthwise. That's in one plane. Muscles are three-dimensional. They need to be stretched in more than one plane. So stretching the ends apart is fine for everything that's pliable and capable of pulling apart, but anything that's hard, that's too late in the progression of tightness, it actually doesn't pull apart with stretching. So at that point, an effective way to stretch it isn't stretching the ends apart. It's actually stretching directly into the muscle, forcing the tissue to stretch and separate. Once you do that, then things like stretching conventionally actually become effective. So right now, what she's actually doing is stretching her muscles. She's stretching it with pressure. So you want to go all the way up and then all the way back down.
Yep.
Okay. Now we're going to take it slightly anterior, so a little bit more forward, coming in at a different angle, and we're going to repeat that process. So starting at the bottom, working your way all the way up the muscle. And you'll notice a distinct difference with each angle. So it might be the central line that's the most tender, it might be the anterior, it might be the posterior line. Whichever line is more tender, keep that in mind, is that's the area that needs a little bit more work. Muscles should not be tender when you push into them. There should be no sensitivity. So a muscle that's healthy, a muscle that's pliable will be soft and spongy, but with no sensitivity, even with heavy pressure. So keep moving with that cadence about every 3 seconds. It's easier to move the knobble rather than moving your body. So whenever you first start out, find a position that's comfortable, that you can make sure that you can sit there for 5 or 10 minutes, using your body weight just to kind of rock on and off, and then moving the knobble. Because if you're shifting your body, I don't think you'll last very long. It won't be comfortable.
That's right.
And then move back down, yep. So you want to do that whole line very thoroughly. So remember, the first pass typically is pretty tight and pretty sensitive. And the second time, you should notice some change. So the sensitivity should decrease, and the level of hardness or the texture of the muscle should soften a little bit. Those are the changes you're looking for. Good. You might get a sense of warmth. That's a good thing. That's blood nourishing the area. Tight muscle tissue is typically congested, full of lactic acid. It'll burn. So these are some of the sensations that you'll get. So a burning sensation, some of the pain, those are typical symptoms that you'll feel while you're applying pressure. So be intelligent. If it feels extremely painful to very light touch, definitely stop. It should feel good. It should be a good hurt.
All right, I got to the bottom.
Yep. Now we're going to do the posterior side.
And I remember, Eric, you were telling me that my posterior is not that far from my anterior when it comes to this.
Yes.
muscle.
Yeah, we're talking ½ inch or so.
Okay.
So if you have a seam going down the side of your leg, that would be the central line, and then we're slightly going in front of it and slightly behind it. So we're not into the hamstring or the front of the quad.
And how many people do you think they have tight IT bands, but actually?
I want to say 100%. On a daily basis, people come in and they say that they have tight IT bands. And what I really want to say is great, you should have a tight IT band, but I don't. I say, that's fine, we will loosen it up. But what we really mean is the vastus lateralis underneath it. They've done studies where they've taken an IT band off of a body in dissection and they've held it with pretty heavy weight, and the IT band itself doesn't change. The IT band is very resistant to change, and that's a good thing. But the muscle underneath it is what needs work and pliability restored.
So for me, the back side, the
Yeah.
posterior,
Yeah.
is pretty tight. I know for everybody it's different though.
It's
right?
different for everybody. I have plenty of patients, it's more of the posterior side or the central side or the anterior side. So this can pull in any direction. So it can pull towards the hip, it can pull towards the knee and cause hip pain or knee pain. So if you have knee pain or hip pain and pain down the side of the leg, loosen up vastus lateralis, it'll give you relief.
Whew,
How does that feel?
feel much better.
So very good, we did both sides. We loosened up your vastus lateralis, not your IT band, but what that's doing is that is loosening up this whole lateral quad, getting blood flow into that area, restoring pliability, and then you should be able to run faster, you should be stronger, you should have better workouts, so you have more muscle activation and overall muscle health.
Oh, learned some stuff, did some stuff. Thank you, Eric.
You are very welcome, Gina.